I'm here at Ryde Hospital. We're about to donate a lovely machine to the Ryde Hospital Emergency Department. It's actually an ultrasound vein finding machine, and we're going to find out a lot more about that when we go in there for the presentation. But Ryde Rotary very proud to present this machine to the hospital, and look forward to the whole ceremony.
Is becoming the standard. It's we've been accessing up till now large veins and arteries blind. We have to do it by feel and by bony landmarks, and that's what we've always done. Ultrasound's become a revolution for emergency medicine because it means that you can see where these things are, and it's changing medicine. You know, if I was a patient and I had to have a needle put into one of those things, I would prefer it 100-fold if the doctor could see exactly where he was going. And it's just coming in now. All the emergency doctors are in the process of learning to use these. The other thing is that the other big thing for ultrasound in emergency medicine is what we call fast, focused abdominal sonography in trauma. And it means that you can see very rapidly if the patient has about 5 specific conditions: fluid around their heart, an enlarged aorta, fluid between the liver and gallbladder, or between the liver and kidney, and fluid around the spleen, and also fluid at the base of the abdomen. And if you can see those things, it suddenly changes your knowledge of what the patient needs, and it really speeds things up. And in the past we had to wait for a formal ultrasound in radiology for those things, and that really wasn't fast enough, or we had to and we had to do these procedures blind. So there's 22,000 patients a year who come through here who potentially benefit by people just being able to do those parts of the job better. And so thank you to Rotary and thank you to Jacobs Medical. We could not have got it without you. Structures it looks like there, but that's in frozen time. But as you can actually see it move in real time, so you can move around finding. It gives it like an echo, off any surface between a hard thing and then especially a liquid. So you're seeing sort of skin surface, and then there's a thing called deep fascia that's probably what we're seeing there. We may be seeing fluid, and this colour is shows you direction of flow, so that you can separate an artery from a vein, and you can also see by putting on the colour, you can see where. So there we are. See that flash of colour there? That's telling you where the artery is, and it's probably also, if our subject is in front of 27 people staring, it will make your vessels constrict a bit. So that, but you can see how hard that would be to find with a needle, blind or just by feel of the pulse. And then, but when you can see a flash like that of colour, or when you can see the black structure that indicates a deeper vessel, it gives you something to aim for. And that's, see, can you see that black? That would, and if you introduce a needle, you can see the needle very sharply white and see where it's heading, so that you can see that, Dr.
draw straws for that one.
I'm not drawing.
These are, I think that'll be a tendon going as we go across the wrist.
Correct. We're coming down there.
And over here is about where we'll see the vessels. And just like looking at x-rays and just about everything else, it's also a matter of doing thousands of them, and you get better and better at seeing what you're actually looking at. Across the elbow. So if you're having difficulty seeing them, they're quite easily visible as sort of black circles. And you can see that if you inserted a needle, you could follow that needle into the vessel. I've done one at another hospital where we had an ultrasound machine in a child that we had great difficulty getting access, and then you could see on the ultrasound that the needle was actually deforming the vessel, so you were in the right spot and just not getting blood flashback. And without the ultrasound, you would never have known that you were in the correct spot. Can you see the pulsation?
No.
Indicating that that's the artery rather than the vein just there. That's I don't know if you can you see that there will be patients who are better off as a result of it.
Thank you.